Namaste. Welcome to my channel. This is Priyadarshini. We all of us are aware of the present situation due to the pandemic, and in this hard time, our corona warriors are fighting for us. Let it be a myth or a fact, everything around us is about COVID-19. Whether it is about its controversial origin, Trump's fight against China, Sonu Sood helping the migrants, or the discussion whether the lockdown was beneficial in India or not. Every day the number of cases are increasing, and it should be a huge concern for us. The latest news of New Zealand having no new cases active is a silver lining for us. We too can do it if we follow few precautionary measures. In this video, I'll discuss about the origin, transmission and the effects of COVID-19.
Coronavirus are a group of viruses having RNA as their genetic material and have the potential to infect especially mammals and birds. In December 2019, the COVID-19 originated in Wuhan City, China. On 11th March 2020, WHO had declared COVID-19 as a pandemic. During the initial stages of infection, COVID-19 was said to have originated from a seafood market, a live animal market present in South China. However, studies also suggest that the virus was derived from a recombinant virus between an origin unknown virus and bat coronavirus. Pangolins were reported to be the intermediate host, but still it is not confirmed. Bat coronaviruses, by cross transmission, the virus transferred into wild animals, and when these were consumed, it got transferred into human and were infected. Then started human to human transfer of virus. Common cold, fever, dry cough, sore throat, nausea, loss of smell and shortness of breath are the symptoms developed by coronavirus infected person. In severe cases, symptoms include chest pain, difficulty in breathing and walking. It also causes pneumonia and multiple organ failure, which leads to death. The incubation period of the virus ranges from 2 to 14 days, and hence it is suggested to quarantine people for 14 days if such symptoms appear. Similar symptoms were seen in infected animals, as in a pet cat owned by infected person in Belgium. It showed symptoms like vomiting and diarrhea. Similarly, tigers in Bronx Zoo were too tested positive. Now, transmission. As of January 2020, 55% of the initial confirmed infected cases were linked to the Wuhan seafood market. Reports indicate that the respiratory droplets exhaled by the infected person while talking, sneezing or coughing is enough to infect a person in close proximity. However, WHO declared virus transmission by air as a myth. Still, coronavirus was reported to live on non-living things for certain duration. COVID-19 was reported to follow symptomatic transmission, which means there is transmission of virus from an infected person while experiencing symptoms. Pre-symptomatic transmission. It refers to transmission of virus during its incubation stage inside the host. Incubation period is the phase between the time of infection and the onset of symptom by a person, and when a healthy person comes in contact with the droplets, direct contact or in contact with the things contaminated by the infected person, he too gets infected. Asymptomatic transmission. It refers to the transmission of virus from a patient who has not developed any symptoms. And laboratory asymptomatic confirmed case is a person infected with COVID-19 who doesn't develop symptoms, hence unknowingly infect others. Coronavirus usually infects the lower and upper respiratory tract of the host, but presence of virus in serum or plasma is normal. Hence, there is a huge risk in transmission of virus through blood during blood transfusion processes. Now we will see about how the COVID-19 is diagnosed. According to WHO, the standard method of testing is real-time reverse transcription polymerase chain reaction. This test is usually carried out by taking samples of saliva and swab from the nasopharynx of the infected person. Blood samples can also be used, but within certain limitations. First, the RNA is extracted from the sample using certain chemical solution. Then the RNA is reverse transcribed to DNA. Then additional short fragments that of DNA that are complementary to specific parts of the transcribed viral DNA are added. If the virus is present in a sample, these fragments attach themselves to target sections of the viral DNA. The mixture is then placed in RT-PCR machine. The machine creates new identical copies of the target sections of viral DNA. Usually this continues for 35 cycles, and as new copies are built, the marker labels attached to the DNA strands and then release a fluorescent dye which is measured by the machine's computer. When a certain level of fluorescence is surpassed, this confirms the virus is present. In this slide, we can see the CT scan of patient suffering from COVID-19. It reveals visible interlobular septal thickenings and patchy ground glass opacities. This may be due to alveolar lining injury due to diffusion of the virus. Now we will discuss about the effects of coronavirus on people. First, on pregnancy. Pregnant women are more vulnerable to the virus due to their immunosuppressed state. Low immunity during pregnancy aids in saving the fetus from getting rejected by the mother's body. A study revealed that the women who were infected in the late phase of pregnancy didn't develop acute symptoms nor died. No birth asphyxia was observed in newborns. The transmission of virus from mother to baby during pregnancy is not possible. It is observed that COVID-19 infection in case of children is less severe compared to adults. Now let's see the effect of COVID-19 on smokers. According to the reports, smokers were 1.4 times more likely to have severe symptoms and approximately 2.4 times more likely to require intensive care. Now in old people. Old people are more vulnerable than younger ones, perhaps due to antibody dependent enhancement during coronavirus infection. Due to weak immune system, in old people the rate of production of antibodies is low. As a result, the virus doesn't get neutralized. And as we see on the right side of the slide, the antibodies produced in this case forms an unstable complex with the virus and starts infecting macrophages, and this intensifies the infection and leads to cytokine storm and then even death. On the left side of the slide, which is in younger people, we can see the rate of producing of antibodies is more, hence neutralize the virus and make them inactive, resulting in recovery without any complications. Now, let's see its treatment. As we all know, there is no proper medication for the cure of COVID-19, and even many countries are on research for its vaccine. Some vaccines are ready for human testing and hopefully will be in market soon. Still, to fight the infection and stopping it from being worse, various medicines are being used, and in that chloroquine and remdesivir are used the most. Chloroquine blocks the viral infection by the increasing endosomal pH. Remdesivir is an antiviral drug and is an adenosine analog which fits into the viral RNA chain, resulting in early termination. severe patients and with people with weak immune system, plasma therapy is being used successfully to treat it. It is a simple technique where the antibodies produced by the person's natural immune system to fight against the virus are extracted from the person's body as plasma after he has recovered and is then injected into the infected person so as to help fight the virus. The process has some disadvantages. Artificial insertion of antibodies can suppress the natural immune system of the patient, which may lead to reinfection in near future.
In this tough phase, our doctors and the whole healthcare system is taking best care of us. We should be grateful to them. Even if a person gets infected, he shouldn't panic. Rather, he should quarantine himself and take utmost care so that other people do not get infected. We should take care of our elders, children and pregnant women as they are getting easily infected. We need to break the chain, and to stop the infection, we should follow few precautionary measures such as washing hands regularly, wearing masks in the public, maintaining social distancing, etc. Hopefully, vaccines and medicines will be available soon, but till then, we need to take care. Thank you for watching the video. If you liked the video, please like, share and subscribe. And do not forget to hit the bell icon to get notified.